Welcome to the Synergy Sessions, Aging Smarter in Silicon Valley. I'm your host, Tom Nelson, and I know firsthand as a family caregiver and part of the sandwich generation how tough it can be to take care of your aging parents while balancing your own life, career, and family. We'll bring you the experts and information necessary to help make your life a little bit easier and you a little bit smarter. Synergy Sessions is brought to you by Synergy Home Care, bringing you personalized in-home care and peace of mind to Silicon Valley families. I really do hope you enjoy the show. Hey everybody, welcome back to the Synergy Sessions, Aging Smarter in Silicon Valley. Today we're going to be talking about resources for senior transportation, specifically with Matt Saltzman, owner of Ready Steady Transport Services, and I wanted to welcome Matt. Welcome, Matt.
Thanks, Tom. I appreciate it. Thanks for being willing to host me.
Excellent. Well, I just wanted to start off if you could talk a little bit about what you do, your role, and what your company does, who they serve.
Yeah, thank you. First, what you're doing is amazing. And thank you for not just promoting businesses, but also promoting partnerships. What's unique about what I'm doing? So the company is called Ready Steady Transportation Services. We provide non-emergency medical transportation. The abbreviation and how it's typically referred to is NEMT. So that's an easy way to describe it. And what's unique about what I'm doing is I get to be friends with folks like yourself in home care, in hospice, various types of facilities, and build partnerships and service families and service facilities and service agencies and work in parallel to those kinds of caretaking companies by offering transportation services. And, we can use a lot of fancy terms for what I'm offering, but at the end of the day, I think the best way to sum it up is offering confidence to families, offering safe transportation, reliable transportation, offering continuity of care to seniors. I have tons of statistics here on my screen to remind me of things, but I think the most important one and the one I mention a lot is 1 in 4 seniors miss medical appointments because of lack of transportation. And I think what we're doing in many ways is, yes, we're driving vans, we're certified in different topics, and that's a lot of what we offer. But what we really offer is the outcome of continuity of care and ensuring that seniors or mobility challenged individuals don't miss appointments. They make all of their appointments. They can rely on a partner, especially if they don't have a family member available. In many cases, up to 80% of seniors rely on family members for rides anywhere from 5 to 8 times a month. Many family members don't live in town, or many family members live, 1 to 2 hours away. And that kind of time commitment can be really, really draining for the family member that becomes the caretaker, or it's just simply not possible if they live out of state. And so many family members who do the care coordination for an elderly, parent or grandparent or uncle or aunt really need somebody they can trust and rely on and build relationships. And so that's what we're doing. We're involved with families through the avenue of transportation.
That's fantastic. So we talked about seniors and families, but are seniors your primary customer, or do you have kind of across this spectrum, or who is your primary customer in the various services that you provide? You talked a little bit about medical appointments, but maybe just a breadth of services that your company provides.
Yeah, I'd say 80 to 85% of our clients are seniors or elderly. And similar distribution is mainly for medical appointments. So from a senior living or assisted living or memory care facility to a medical appointment, dialysis, which is, a frequent need, discharges from hospitals or post-acute facilities to a longer term care facility, or sometimes just, from residential home to medical facility. And that's a large majority of what we do, but we also will accompany seniors or mobility challenged with their everyday activities. Just yesterday, I transported a woman to the bank, and today I'm picking her up and I'm taking her to the grocery store before her medical appointment, and we're preparing those tasks in one ride. So we're available for errands and sort of the personal journey that a client may have. We also are very conscientious of reaching out to the event community. I happen to have an event background before I started in transportation, so I have a particular passion for it and I'm aware of it. So I have a wedding planner that I work with, and she's referred, a couple that has a grandmother with mobility challenges in a wheelchair, and they really want the grandmother to be at the wedding. So we booked a wedding. And I really believe in that kind of thing because yes, roughly 80% of what we do is medically focused, but I truly believe that we should pay attention to the social elements of seniors and mobility challenged individuals and make sure they have access to their religious communities, their families, their passions, and their social communities. Could they afford to work with us every week on those types of things? Maybe not, but for special cases and special events, I think we become essential and a great complement to those types of things. So really happy to offer other service outside of medical or medically focused rides.
Got it. One of the things you just brought up that, wheelchair or other kind of nuances to why your service is really important. Just as a high level, what is the biggest difference between you and say Uber or Lyft or something like that? So there's, other dimensions of transportation services out there outside of, and maybe we can kind of go into, where do you kind of fit in the continuum? Because there are the bus and there are the different other public transportation methods. And then there's the other ride sharing. And you're in this niche space. And how are you different from all of those others? And maybe even talk about what the demand is right now, or the need out there across that continuum.
Yeah. I mean, I guess I'll start from, like a financial aspect as how I would group those things and move towards what we do. On the lower end of the spectrum are the, they call it paratransit, which are those wheelchair enabled, mini buses that sometimes a city or a county offers those services. They can be anywhere from free to a very small nominal booking fee. There's one in Santa Cruz called Metro Paracruz. I think it's $5. What's can be challenging, or there can be a barrier to entry for many for a service like that, is you actually have to qualify with a medical need. So many people think you can just call and book a ride, but you still have to build a relationship with them. You have to qualify with some sort of doctor's note for a medical need. Otherwise, that service is unavailable to you. Yes, many do qualify, but also many don't. And so the people that don't get moved on to the next level and pricing point, which would be what you mentioned, Uber and Lyft, which is called curb to curb. Those services can be great. They're certainly convenient because you can call them on demand and have a car within 5 to 25 minutes, but they are not trained professionals. Where in paratransit, you typically do have a trained professional that is overseen by, a larger organization. So they have CPR training. They may have memory care training. They're obviously comfortable with equipment like wheelchairs. They probably have safety training and safety monitoring, and that provides confidence to a rider or to a family. Uber and Lyft is kind of the Wild West, and you don't know who you're getting. And they certainly are not going to get out of their seat to help you into your vehicle. They may not be able to accommodate wheelchair or equipment in their vehicle whatsoever. And I've heard, just qualitative stories. I don't have data on this, but just qualitative stories from some of our clients that they call Uber and Lyft, and they are able to get themselves out of their house into the curb, but maybe be in a wheelchair or a walker. And the driver comes and sees that and cancels the ride and drives away and refuses the ride. And that's a common occurrence.
Oh, wow.
Yeah. So, take another step forward into NEMT. And we can work on mainly a pre-scheduled basis, but we do same day appointment if we get a call and we're able to accommodate it in the schedule. And we take the paratransit model a step further. So the drivers are trained very similarly to some of those county or city resources, but we call our service door through door, which means we are going to come up your driveway to your home. We will walk into your home and assist getting you into your wheelchair. If you're in a gurney, if it's a medical patient, 2 of our drivers come. So 1 driver, 1 assistant. We do the transfer from bed to gurney. We do that safely. We're trained in that. We're trained in memory care, so dementia and Alzheimer's. We're trained in safe driving habits. I call it defensive driving techniques. The vehicles are monitored. The drivers are measured. performance metrics based on safe driving, and we're insured, and we have the liability insurance to accommodate all of this, so that when referral partners like a Synergy Home Care makes a referral, they have confidence that our drivers have been background checked, they're regularly drug and alcohol screened, they have clean motor vehicle records because we check those things as pre-employment. We also check them during employment. And you have confidence that the person that's coming into your home is qualified to do so and is also safe to do so, and will respect the family and respect the individual. And the door through door model allows an individual to book us without needing a secondary person like a spouse or a family member to be there. And so in many cases, we work with families where the spouse may coordinate the ride, but the spouse is not physically capable because they're also elderly in assisting their husband or wife in and out of a vehicle. And so in many cases, we get the families where, maybe the spouse for many years has been transporting their loved one and has just reached the end of their line physically, or they've had their own, unfortunate fall or unfortunate health circumstance and are now limited themselves and can no longer assist their loved one in and out of a vehicle. And we do all of that, quite literally do the heavy lifting. With that comes obviously a more premium price point. But in many ways, again, what we're offering is confidence and safety through the avenues of training and, regular staffing. And many times you're going to see the same driver over and over and over and build a relationship. And that's a wonderful thing too.
Absolutely. That's fantastic. Thanks for clarifying that, because really it is that confidence that you're going to get somebody who's trained, they're going to show up on time, they know what they're doing, they have all that, you're going to get somebody who has gone through the full vetting process, which I think is super important. So you covered a lot of maybe some of the challenges across the spectrum of the different transportation. When we were talking previous to our podcast today, some of the benefits, and it was, interesting to me, not only the obvious benefit of getting to where they're looking to go, but you talked a little bit about health outcomes. And then also maybe talk about, the benefit to the family dynamic. Earlier mentioned a little bit about maybe the family caregivers or family members who are out of state or out of the area. It's a way for them, but maybe talk about maybe some of the not so obvious benefits in addition to showing up on time safely to where they're trying to go.
Yeah. Thank you. So I'll get boring. I'll read some statistics, but I use these statistics in some of our newsletters and some of our marketing materials, but I think it reveals the underlying risk, which is lack of transportation for many leads to, it doesn't necessarily lead to catastrophe, but it certainly leads to reduced level of success in their health outcomes, whatever that may be. So just to be a little bit more specific, there's a 2018 study, I'm going to read a little bit, but that says providing NEMT for patients with chronic conditions, diabetes or kidney disease were common examples, reduces ER visits and hospital admissions by up to 30%. So imagine my hospital partners and my post-acute partners who, they don't want to bring patients back. There's financial reasons for that from an insurance perspective, but also, the health outcome of the individual. They don't want to have repeat visits for this individual because that means the medical attention they received wasn't working. So simply just having reliable transportation reduced 3 visits to ER and to hospital by 30%. And that's huge, not only because of the capacity of the hospital, but also the outcome of the individual. Another one I'll read is specific to dialysis. Missed appointments due to transportation issues are linked to a 20% higher risk of hospitalization and increased mortality with dialysis patients. So that's 1 in 5. And like I said, if 1 in 4 lack transportation options and you're a dialysis patient and you're one of those 4, I'm not going to do the math off the top of my head, but now you have, an additional 20%, compounding risk that this lack of transportation is going to lead to severe health outcomes for you. So, link it back to our model and of course the out-of-pocket cost of our model. In many cases, yes, in many cases it's an out-of-pocket expense, but it guarantees your health outcomes, or at least it certainly contributes to better ones in a measurable way. Really believe in that.
How about for the family? As far as the family caregiver dynamic, how is it benefiting them?
Yeah, I mean, all right, more stats. I have 57% of older adults live in neighborhoods without public transportation. And in many cases, family has to step in to those scenarios. As you probably know on the synergy side, and you probably have even better data than I do,
Right.
family members are very involved. There's not just the physical toll, especially in the transportation world. There's the emotional toll. There's the emotional toll being stress, of course, and burnout. There's the financial toll of, lost time at work, having to take off work and lost wages to go accompany a loved one to a medical appointment during working hours, 8 to 5, or family members, especially in my generation, which is, they call the sandwich generation, or maybe even your generation, the sandwich generation, where you're taking care
Mm-hmm.
of children, but also your parents. You have to make a
Right.
pretty difficult choice in that moment. Am I taking my kid to soccer practice or to school, or am I going with my parent? I don't know what you would choose. I know what I would choose. I would choose my kid. And then the
Sure.
parent, the senior, loses an opportunity to attend an appointment, which leads to these outcomes. So I think, from the family perspective, the benefits are, not just the confidence and the safety piece, but it's quite literally lost wages. So lost money and time. It's lost time and money with loved ones. It's reducing the stress and the burnout of caring for a loved one, which means you can show up in a much different way for that loved one when you do see them, bringing, a lot better positive energy to that loved one rather than worrying about logistics and coordination and scheduling, which is just very stressful. So I'll end with this statistic. The AARP reports that 78% of caregivers provide or arrange transportation for loved ones, averaging 6 to 8 trips per month. So I think what I'm offering is, from a financial perspective, I understand family members may not afford 8 trips with our service every month, but what if we just cut that in half?
Mm-hmm.
And half of the time you were quite literally outsourcing transportation for your loved one. You're outsourcing medical care in a way to us. I think even, reducing your stress by 50% is going to be a huge, huge benefit to a family member and the family dynamic.
Well, I think you hit on something that's really important. I think is overlooked is that the balance and the reduction of stress with that family caregiver. And I would be remiss if I didn't highlight the surfboards in the background there, because your role you're talking about family sandwich generation. I'm the same. You've been in my office. I've got a mountain bike over here. I think it's overlooked, and I think that burnout is a burnout creep. When you don't take that time, you don't take advantage of these opportunities, of these little things, like just having that peace of mind that the ride is taken care of and you don't have to drop everything to go run and go do that, I think is a huge component of that balance. It's already a hard enough job, and to really take advantage of the resources that are available, as well as the other areas of taking care of yourself.
Yeah.
It's that cliche of putting the oxygen mask on yourself first before, the person you're taking care of, because if you burn out, then you can't take care of the person. So thank you for that. One of the things I think it's maybe clear, but just to make sure. So your service, they're paying out of pocket. Are there any other subsidies around that? We talked about the different paratransit as an eligibility based on a socioeconomic level or an earning level, but are there ways to subsidize what you do, or is it pretty much out of pocket? Are there any other options in that respect?
Yeah, there are other options. I am a new business, so right now I'm private pay only. That's a business decision from a financial standpoint. There are plenty of NEMTs, and I aspire and have gone through the application process to apply to Medicaid so that Medicaid can cover the cost of rides. There's an education piece, though, there, a technicality, which is Medicaid will only cover the cost when it's medically necessary, when it's ordered by a doctor or a facility, just like a prescription. So even when I do have the ability to take insurance, which is around the corner for me, fingers crossed, I hope, I can't just apply the ride to insurance when I get a phone call from a family member. It doesn't work that way. I have to be initiated through professional clinical caretaking, and then those rides can be applied through insurance. Or the other avenue is if you have insurance benefits and transportation is covered, which for Medicaid, and in my region, the group is Central Coast Alliance, which is the most common. They do offer transportation benefits, but first you have to call your insurance provider, and then your insurance provider basically brokers out that ride to other service providers. And so then there's, from an administration perspective, the secondary process of me making myself known and introducing myself to as many possible medical provider networks as I can to build relationships and enter into service agreements and qualify through their compliance, measurements. And I am in the process of doing all of those things, but all those things take time. So in the short term, as just like a micro level, I am only private pay currently. Macro level, NEMT can be covered by other sources. And then there's, every county and city offers different types of nonprofit funds that can benefit individuals depending on their specific scenario. So I always encourage people to, look to their city or their county, what kind of nonprofits are out there. For example, I work with a veterans nonprofit called Vets for Vets in Santa Cruz. And I know that they have, it's probably very small, but they have a small budget for their veterans inside of their community that if they're in desperate need of transportation, the nonprofit will then reach out and contract a ride to benefit the member of their community. So there's all sorts of different avenues in the nonprofit world. And I take it upon myself, again, similarly to the medical provider network, to make myself known to those nonprofits that are local and offer a very different pricing strategy for those types of nonprofits, to respect that they have very limited annual budgets. And I understand those things. So there are definitely alternative avenues. The quickest and most reliable avenue is private pay, but I try to offer all sorts of creative solutions for families. We offer $20 off for your very first ride with us, just as an introduction. If you're a referral from a particular agency or a particular facility that I'm already partnering with, I offer different types of escalating discounts depending on the partnership I've built with that particular facility. If you're a dialysis patient or you have frequent need, I offer ride packages. So you can pre-purchase 4 rides and get a discount off of the base rate of those rides. You can purchase 8 rides and get a larger discount off of the base rate of those rides. Like any kind of product or service, I'm trying to be creative to find ways for people that, their only option is the private pay out of pocket model. At least we're offering some benefits financially other than just, the premium service benefits that we're offering, and try to meet people where they are as best we can.
No, that's great. And, certainly probably the most expensive for you is a one-time call, get them coordinated. But if they're able to have a consistent, nice, loyal schedule, transportation, sounds like you're providing some benefit there.
Yep.
For those types of longer term customers, which is great. And it sounds also, based on what you're saying earlier, they may have an 8 ride need, but they're only working with you for 4 rides. And it sounds like there's some other potential options there to supplement the other 4 rides. And you're working with them on those types of things to make sure they get what they need, but also stays within a budget that
reasonable.
they can afford.
Yeah.
That sounds great. And yeah, certainly the private pay is always going to be the most convenient. They're going to have the most control. But it sounds like if Medicaid and is coming into the picture, and I'm imagining the demand with the senior population growing and growing. My statistic that I've heard is something like 11,000 people are turning 65 every single day for like the next 20 years.
Yeah.
So the demand is going to increase. So there needs to be creative ways, not only in providers, but also how they pay for them. It sounds like you're in the mix, and you're putting your application in to be able to serve people in all those other, payment dimensions, which is fantastic.
Yeah, absolutely.
What is, a little bit on that, what's the best way for someone to contact you? Should they wait for the same day, or if they're perceiving like in advance? I mean, what's the best way that they can ensure getting a ride and having it as smooth as possible, coordinating with you? What's that process?
Yeah.
Ideally, I mean, you said you could jump in on the same day if you have room, but what's the best way to ensure that they can schedule something in advance?
Yeah. With anything, pre-scheduling allows us to guarantee the time slot, more or less. That's what we're doing, is booking time on a physical asset with a person who has a schedule. So what I recommend to families is as soon as you book that doctor's appointment, call us and book us to accompany you to that doctor's appointment. At a very minimum, we hope for 24 to 48 hours in advance so that we can 100% guarantee that ride. When we get same day calls, we make every efforts that we can to accommodate it. And in most cases, we can. I've only had one instance where I've had to say no, and then called a local competitor that I've, reached out to and have built a relationship with and said, "Hey, I can't take this customer today. Can you?" And do our best to still problem solve with that customer and make a referral. But yeah, same day is challenging, as you can imagine, because you might already have a whole schedule and a whole layout of a day, and getting a call in one part of town versus the other part of town can be tricky logistically. But there's also been instances where we've had same day calls and those medical appointments are a walk-in. And so I've asked that person, if this isn't a time urgency, like you're calling me at 10 a.m., you don't have to be there at 11, can I pick you up at 1? Will that work for you? And so in those same day instances, we just look for more flexibility with the customer. And if we can work on that level together, then it increases the chances that we can do it. But the best way really to work with us is give us a call, send us a text, use our website. We have a website inquiry form, and reach out to us and tell us about the date, the time, the context. Is this person in a wheelchair? What facility or residential, location are we picking them up from? Do you want us to stay with that patient through the appointment, or are you okay with a will call pickup, which means we'll set a pickup time anywhere from 30 minutes to 90 minutes after the initial drop off to ensure that we're there for the return trip, which again is another big benefit to using us versus a paratransit option, because the paratransit options are on fixed routes. So they may be great at picking you up, but they fall apart at the return trip, and many people have to wait very long periods of times in the waiting rooms of their appointments for their return ride, because that paratransit bus now has a dozen other people to drop off and pick up and drop off and pick up, and it can take hours.
Oh, right. Wow.
Yeah. And in many cases, families that call and, are budget sensitive or feel a little sticker shock when they hear our pricing. I try to encourage them, take Metro Paracruise to your appointment and let us pick you up to go home. And the big benefit there is you get to sort of mix and match your pricing points. So let's have a little giggle and call it dollar cost averaging your pricing points.
Yeah.
But you're getting the confidence that you are going home immediately after your appointment, which is not something that some of the fixed route county resources can provide you. That's where they fall apart. So that was a long-winded way of saying,
that's a great point.
Book us in advance, and that helps us secure your ride in a convenient way.
Yeah. Well, and just a point that you can mix and match and collaborate with other agencies for the best possible outcome, whether economic or just the convenience, or maybe they need to be somewhere in the afternoon. They don't have 2 hours to wait for the pickup. They may need something a little bit more predictable. So that's fantastic. What else? I'm going to put you mentioned your form fill on your website, and we'll put all of your contact information in the notes so people can reach out to you and for their specific situation, or ask more maybe questions that are more, individual to them. But is there anything else we should know about your company, or maybe something that we missed today that could be helpful for folks?
Yeah, thanks. I just say, yes, I'm based in Santa Cruz. Yes, the company is sort of born here in Santa Cruz as a local business, but we're serving Monterey County and we're serving Santa Clara County. Those are areas that are totally in reach for us, and we're already doing the work to build partnerships with agencies like yourself and facilities in both of those counties. Because we're the private pay model, we don't run into county line restrictions that a lot of providers do when you're taking insurance, and insurance has pretty strict regulations around the distance of those trips, which relates to the financial impact of that trip. So obviously insurance is only going to want to approve a certain, financial investment for any single trip, which can also be limiting. So yes, you may want to use your insurance, but you need to get from Santa Cruz to Stanford in Palo Alto. Insurance might not cover
Yeah.
100% of that ride. They might only cover 10% of that ride. So you might be forced into a private pay scenario anyway. So you might as well work with us because we're going to work with you on that pricing point, because that is a longer distance ride. So that's what I would say is you should know is we service those 3 counties, Santa Clara, Santa Cruz, and Monterey. We're a great option for longer distances. We're a great option for family members that don't live in the same city, either as their medical appointment or as their caregiver, as their family caregiver, because we can provide that confidence to families. And what you didn't know about us is, I kind of mentioned it earlier, is we love events. We love social gatherings. Like I said earlier, it's part of my career background is events. And so I really believe in the arts and have inspiration from my own grandparents who attended the arts well through their retirement. And I want to offer that same access to seniors in Mobility Challenge. So call us for the weird thing that you don't think that we would accommodate, because we will take you to the theater and pick you up at 10 o'clock at night afterwards. We will take you to your granddaughter's wedding. We will take you to the grocery store. We will take you to the airport. Those things are all within reach for us.
Well, I mean, that's such a great point. I mean, first of all, that the crossing over county lines relative to insurance and actually other providers have restrictions in that respect as well. And that's absolutely good to know. But I love the extending and enhancing the quality of life. You know, the medical appointments are certainly an essential need, but this is just, especially if it's like an occasion, an event, or I know my dad's caregiver used to take him to Santa Cruz because he loved it from, his home in Campbell, and not letting transportation stand in the way of living, a really great, maybe even best life. It's like there's different limitations all along the way, but do what you can. And this is such a great service to give people that freedom to continue to do the things they want to do and live that high quality of life. Well, thanks so much, Matt. Really appreciate it being here on Synergy Sessions, our Aging Smarter in Silicon Valley. I've gotten a little smarter today from talking to you about transportation for seniors and others. Again, contact Matt if you have specific questions or would like to learn more about his services and if it would be a good option for you. And we will see you next time. Thanks again for being on the show, Matt.
Thanks, Tom. Really appreciate you having me and appreciate your time and access.
Awesome. Take care. Thank you for joining us on the Synergy Sessions. We know you have a lot on your plate, so we really appreciate you spending the time with us today. If you found the information in this episode useful, please reach out to the guest or the resources in the show notes. I know they would appreciate it and would love to help. Also, if you have an idea for a future episode, please reach out to us on Instagram or Facebook or email us and let us know. We'd love to hear from you and provide information that's useful. Lastly, please remember, you don't have to do this alone.